What's up, guys? We're doing a video assessment on my roommate here, Aaron. So what we're gonna go over is the single leg squat today. In his single leg squat, on his left side, he's pretty good. But on his right side, you'll see a little bit of knee valgus. So I have him demonstrate his left side first, and then we'll go into his right. So as you can see, his left side keeps his knee in line. But if you look on his right side, you can see his knee kind of comes in a little bit and has that like knee valgus positioning. It's a pretty significant impairment because it increases his Q angle of his leg. And that increase in Q angle may lead to potential injuries such as ACL tears, patellar tendinopathy, or patellofemoral pain syndrome. And one of the big reasons that we can kind of guess why Aaron is going through with this is that he's a student here at GCU, and as a student, you're going to have prolonged sitting periods throughout the week with class, studying, and all that jazz. And it results in an underactive and weak glute med for sitting too long. And that underactive glute med will then lead to synergistic dominance in your TFL. And that synergistic dominance will result in becoming the TFL becoming too tight and overactive, which causes that increase in Q angle when he does his knee valgus position. So the first thing that we're going to do for Aaron, we're going to use an inhibitory technique. And so for the inhibitory technique, we're going to use self-myofascial release. However, we're not going to use, so I am using a percussion gun. However, I'm not using the rapid motion of a percussion gun. I'm just using it as an extension to be able to apply pressure. I'm mostly just using the ball to apply pressure to the TFL. And then what I'm going to do is I'm going to roll, so I'm going to find the TFL first, find the TFL, and then I'm going to roll over the painful areas very slowly until I get a release in that area, or that the pain starts to subside or the tissue softens. Roughly you want to do this for 30 seconds with maximal pain tolerance and 90 seconds for lower pain tolerance. The frequency, you could do this daily unless specified otherwise by your doctor. The sets, just one set, repetitions as many as you want. And the goal of this is just to alleviate the symptoms of trigger points and influence the autonomic nervous system. So the second technique that we're going to do is lengthening technique, and for this we're going to do static stretching for the TFL. Similar precautions and contraindications to the one prior would be special populations for seniors, hypertensive patients, and an acute injury or muscle strain or tear of the muscle that's being stretched. The goal of this is we're trying to decrease muscle tension and the probability of injury, and it'll also improve range of motion. We want to do this daily unless specified otherwise. However many sets you want to do, but the repetitions are 1 to 4 reps. Duration is going to be 20 and 30 second hold, and then a 60 second hold for older patients, which is about 65 years and older. So what we're going to do first, we're going to get in a stride stance. That outside leg is then going to point, outside foot is then going to point out, so externally rotate. Hand on hip, hand is going to come across the body, and now what you're going to do is you're going to open up the hand towards the ceiling, and then turn your torso towards the ceiling, holding that position for 20 to 30 seconds. Before going into it, contraindications and precautions to isolated and positional strengthening includes neuromuscular disorders, clients with poor core stability, acute muscle tears or strains of the muscles that we're working on, acute rheumatoid arthritis, and pain during the performance of the motion. If they don't have any of that, then we're good to go. However, the frequency that we want to start doing this isolated strengthening is 3 to 5 days per week. The sets, it's 1 to 2 sets. Repetitions are 10 to 15 reps. And the duration of reps, you want to do a 2-second isometric hold at the end range of motion, and then slowly bring it back in 4 seconds eccentric. So I'm going to have Aaron here demonstrate that for us. Normally you would have this wrapped around something sturdy like a pole or whatever. However, I'm in my living room, so I can't do that. So I'm going to be his pole for him. So I'm just going to put it around my leg, Aaron's going to put it around his right leg. And what he's going to do, he's going to do hip abduction. This is going to focus on glute med. He's going to isolate that muscle. So what he's going to do, he's going to take 2 seconds to kick, or he's going to kick out to the side, hold it 2 seconds. So go ahead. 2 seconds, 1 1,000, 2 1,000, and then 4 seconds back in. 1 1,000, 2 1,000, 3 1,000, 4 1,000. Good. He's going to do that for 10 to 15 reps. We'll do one more rep just for demonstration. So go ahead. 2 seconds out. And then 4 seconds back in. Perfect. And then besides positional isometrics, we also besides isolated strengthening, we also want to do positional isometrics. So for positional isometrics, its frequency is like as needed. You're going to do only one set of this, and it'll be for 4 repetitions. The duration of the repetition, you're going to do a 4-second isometric hold at the end range of motion. And each rep is going to increase in percentage of your maximum contraction. So we're going to start at 25%, then we'll go to 50, 75, and then 100. And then in between each contraction, we're going to rest for about 2 seconds. So we're going to get onto the floor here. And you're going to want to lie down on your left hip, facing towards the camera preferably. There we go. So we want to make sure he's stacked. So hips are stacked. To make it more isolated for his glute, I'm going to bring his right ankle back a little bit and have him force his hips forward, so that way it kind of isolates the glute med. So bottom leg's going to bend a little bit, so go ahead and bend the bottom leg. Top leg stays straight. Push it back just a little bit. I'm going to then put most of my force on the lateral side of his shin, as he's going to press up into my hand for 4 seconds at 25%. So go ahead. 4,000. Good. Relax for 2. And now at 50%. Go ahead. 1,000. Good. 75. Good. And then 100. Good. Following the positional and isolated strengthening techniques, we're then going to go into integrated dynamic movement techniques. This is going to increase multiplanar neuromuscular control. It has the same exact precautions and contraindications as the positional and isolated technique. For frequency, you're going to do this 3 to 5 days per week. You're going to do roughly about 1 to 4 sets. Repetitions is 10 to 15 reps. And the duration of each rep should be pretty slow. We want it slow and controlled. You have 2 different techniques that I like to do for glute med. So for glute med, you can do what's called multiplanar single leg reaches. And so all you're doing is reaching forward, kind of like that single leg squat, reaching out to the side, reaching straight back behind you, and then you're also going to do a curtsy. All of this is isolating that glute med. And then another one that you can do, you can go to a track, put a TheraBand around your knees or your ankles or even your feet, and you're just going to do side steps to the track. This also isolates that glute med. When we do those side steps, we want to focus on keeping our feet pointed in front of us, not dragging it on the ground, and then also being nice and slow on our steps. Thank you for taking the time to watch my video, and that's my benchmark presentation.